Hello people, it's time to look at the signs of respiratory system. So basically you will look at the shape of the chest, etc., physique. Then you will look at if the person has fever or not, pyrexia. Then you will look if the person has dyspnea, that is difficulty in breathing, breathlessness, tachypnea, fast breathing, that is greater than 20, isn't it, for an adult? That will be tachypnea. Then intercoastal recession, is he, having some indrawn chest, etc. Breathing, is it abdominal or thoracic, thoraco-abdominal? Which one? We have to look at that. Then cyanosis, guys, basically, is there some peripheral cyanosis or central cyanosis? We should look at that because of lack of oxygen, isn't it? Action of accessory muscles, if is he using any accessory muscles, like accessory muscles for inspiration can be the scalene, the trapezius, and the pectoral muscles, right? For expiration, it can be latissimus dorsi and which is the other one? Yes, we'll come to that. Then clubbing is, if there's, you will look at the nails and you will see if there's any clubbing. Then lymph nodes, you will check if there's any enlargement. Tracheal position, you'll have to check if there is any deviation of the trachea. You'll look for the trail sign, etc. Shape of the chest, you will look for, right? Then, we already told you that, right? Then chest movements. So basically in males, it is, what is it? It is abdominothoracic, right? The breathing. In females, it is more of, thoraco-abdominal. Why? Because the diaphragm doesn't descend much in females, okay? Then coming to apical impulse, can you feel any see any apical impulse? Breath sounds you will check. If there are any added sounds, you have to look at that. Is there any pulmonary hypertension, right? Is there any sign of heart failure? Is there hoarseness of voice because of the injury to the nerve, etc.? Let's start with the clubbing, guys. So basically normal is the Lowy bond angle, and here you can see clubbing. This is more like a parrot beak, isn't it? Appearance. So that indicates the grade of clubbing. Here they are checking for the fluctuation, guys, and then here you're checking the normal nail bed angle, right? And the grading of clubbing, you should know parrot beak, drumstick, so many terminologies here. Then you have the Scamroth sign, right, in clubbing. There's a lot of information on why clubbing happens. And as you can see here, it could be pulmonary cause, cardiovascular cause, gastrointestinal cause, so many miscellaneous causes, etc. Guys, all the remaining signs, right, we will cover when we are doing examination. So you'll have to examine the neck and also the upper respiratory and the chest, right? Thorax you'll have to examine. So neck you will look for lymph nodes, etc. And then you will look for any veins, okay? And basically remember, all the signs we'll try to elicit in the examination, okay? So inspection, let's start in the next video. Just note that breath sounds, you have normal vesicular breath sounds, right? And you have bronchial breath sounds. Then what else? Absent breath sounds, there can be no breath sounds, is it? Added sounds can be there, like crackles, rhonchi. There are types of wheeze, okay? Fixed monophonic wheeze is there, a random monophonic wheeze. Wheeze was also there in symptoms, if you remember, actually, but it was not covered, is it? Wheeze can be a symptom also. So look at the vesicular sound, goes up and slowly it's coming down. So this is, expiration is shorter. Bronchial, loud and clear, expiration and inspiration, same duration, separated by a pause. There's a pause here. Okay. And here they are showing the types of wheezes. Here you have the fixed monophonic wheeze. That is the first one you see, this first box here. This is the fixed monophonic wheeze. Then you have the random polyphonic wheeze. Then you have the expiratory polyphonic wheeze. And then you have the sequential inspiratory wheeze. So many types of wheeze, right? Monophonic, polyphonic in that you have random and expiratory. Then you have inspiratory, sequential. So many types of wheezes. When you talk about, miscellaneous sounds, you can hear some pleural rub, pleuropericardial rub. There could be stridor. So basically in this video, we wanted to cover the signs. So let's get started with inspection in the next video.